Hi, I'm Dr. Anthea Rhodes, paediatrician here at the RCH and your host for this winter wellness series of the RCH Kids Health Info podcast. Today's episode will focus on COVID, the flu and the common cold. And joining me to talk about this and give us lots of great advice is paediatrician and immunisation expert Dr. Margie Danchin.
Hi, Anne.
From the Royal Children's Hospital Melbourne, this is the Kids Health Info podcast.
Great to have you here, Margie.
Thanks for having me.
So winter's just around the corner. Today we're going to chat about three of those common viral illnesses that families might experience: COVID, the flu, and then the common cold. Can you start perhaps by telling us a bit about the difference between these three scenarios?
They actually present really similarly. So it's very hard to tell the difference initially just by the symptoms, because we know that children and adults get a runny nose and a cough and a fever, and they feel really a bit unwell and fatigued. But then they tend to differentiate slightly. So, for example, with the flu, kids can get really achy and feel more unwell. They can sweat more and they might be confined to bed and feeling really horrible. With COVID, I think very similar, but perhaps more of a sort of a spicy cough, sometimes a bit of loss of smell or loss of taste. There might be some other sort of vague symptoms. And cold viruses, kids just generally aren't as sick. They're just really snotty and congested, but they're pretty much playing and getting around, with their usual activities. So it's very hard for parents to tell which one's which.
How important is it to actually know whether it's COVID or whether it's the flu, for example?
It's not really that important to know which one's which. I think if your child has an underlying medical illness or is at higher risk of getting seriously unwell, or perhaps there's another family member in the household who's at risk of getting seriously unwell, it's important to know if the child is bringing flu A home, for example, or COVID, because that might put another family member at risk. But otherwise, and in terms of transmitting these infections, back to school or kinder, it might be useful to know. But to be honest, I think the approach to all of them is to treat the symptoms and, of course, to try and prevent them happening in the first place.
So can you talk us through prevention? What's the best way to help keep families well this winter?
So the best way for parents to protect their children this winter is really to think about vaccination. And that's particularly around flu vaccines, which in general become available in pharmacists and for general practices in April. So we really encourage parents. It's free for all children 6 months to 5 years. A lot of parents still don't know that. Really important. It's free. In the first year that the child gets a flu vaccine under the age of 9, it's actually 2 doses, 1 month apart, but otherwise it's just one vaccine for all kids. Over the age of 5, parents do need to buy the vaccine, but it's generally about $30 a dose, and so important to protect them from flu this winter. It might not stop them from getting flu illness, but it will stop them from getting seriously sick and going to hospital. For COVID vaccines, we know most people and kids got their sort of primary series of vaccines, but children who are eligible and haven't had a vaccine can go and get 1 dose through their GP. And then unfortunately for the common cold viruses, there really isn't any specific vaccine. It's all about really general hygiene practices for prevention.
And so often families will say they feel like their kids are just sick constantly through the winter. Perhaps they've even had vaccines that are available to them. They're doing their best, but they're still constantly running into illnesses. And parents often ask, is there a problem with my child's immune system? Is there something else I should be doing to really try and keep the family well?
Parents really do say that their children are constantly unwell and constantly getting viral infections from kindergarten or daycare, especially in that first year. We didn't see that in COVID, but all of the usual respiratory viruses and that pea soup is really coming back this year. In fact, their children's immune system is completely normal and robust. It's normal to see that many respiratory infections early in a child's life. That's when they start building immunity. But of course, it makes them miserable. So hygiene practices are still really important. We do want kids to wash their hands, especially before they eat, or teach children, even toddlers, to be able to cough into their elbow and not spray that, the mist with the viruses and the droplets into the air to infect other people. So those common practices viruses are just really important to teach kids early.
And you mentioned that in that first year they can get many viruses and seem constantly sick. What sort of number is usual or typical?
We would say that children in the first year, the first winter that they go through, can get 8 to 12 viral infections, and that's normal. So it's pretty miserable, and that's obviously higher if they go to daycare or kindergarten. Unfortunately, that number of infections happens, and it's building up kids' immune systems, but it means lots of sleepless nights for parents and a bit of missed time off work as well to care for them.
And so if parents are at home and they're looking after a child who's sick with these sorts of symptoms, what sort of advice have you got about managing your kids at home?
When a child first becomes sick, we can really only keep them comfortable by treating the symptoms. So initially, fever, being miserable, we can use things like paracetamol or ibuprofen, but we don't need to treat fever if they're not uncomfortable. So fever is a normal response to infection. But keeping up fluids is really important. Little children can become dehydrated quite quickly, especially if they are vomiting for a short period as well or have an upset tummy, and just making sure they get lots of rest and sleep, and if possible that they are still eating well, nutritious food. They shouldn't be eating a lot of sugar and junk food. We want to try and get sort of good nutritious food into them.
Excellent. And just perhaps a last thing for parents, Margie, when might there be signs that things are perhaps becoming a bit more serious, they're not really improving at home, it might be time to go and see the doctor?
Yeah, it's really good to know what those red flags are for a more unwell child, because obviously these kids are sick with these viral infections. But if they're very listless and they're not moving much, they're not responding much to questions, they don't really want to get up, if they're not drinking, if they're very pale or they're not responding as well, these are what we call red flags. And you really should take them to a doctor because it can be a sign of more serious illness. We know that children who get viral infections are actually a bit more likely to also get a secondary bacterial infection. So sometimes these children might actually have a bloodstream infection or some inflammation around the brain like meningitis or something else more serious. So if your intuition as a parent is telling you, oh, my child just doesn't look right, they look sicker, then I really think parents should listen to that and just go and get a medical assessment.
Really great advice. So something that starts out simple like a cold or flu-like illness occasionally can become something more serious, and that's when you might need to go and get reviewed by a doctor.
Yeah, absolutely.
Thanks so much, Margie. Lots of tips there to help keep kids well this winter. Look forward to having you back to talk about RSV.
Thanks, Anthea.
Information in this podcast is general in nature and is intended to support, not replace, discussions with your doctor or healthcare professional. If you have concerns about your child, please consult your local healthcare professional for individual advice. This podcast is recorded on the traditional lands of the Wurundjeri people of the Kulin Nation, and we pay respects to their elders. Kids Health Info is funded thanks to the support of the Royal Children's Hospital Good Friday Appeal.